I was off work earlier this summer for about 6 weeks because at the age of 39, I contracted shingles on my face. It started on a Wednesday morning with a really bad headache at work. 3 days later, I started to develop a rash on my forehead, but it wasn't until the next morning, a Sunday morning before makeup, my co-anchor, Mark Strell, took one look at me and said, "You have shingles." I said, "No, I don't. I'm not 65. I don't have shingles." A few hours later after work, went to urgent care. Lo and behold, I did have shingles. Thus, my painful journey began.
Okay, here's the rash. This is like day 2. Look at this. Goes straight down my forehead, like a line practically. Day 3 of shingles for me. Here's what it looks like today. My eye is really swollen. I could barely open it.
The shingles diagnosis kicked off rounds of doctor's appointments, different doctors every couple of days for weeks. First up was making an emergency appointment with an ophthalmologist because the shingles run my eyelid and up onto my forehead. I probably went back to that ophthalmologist 4 or 5 times in the beginning.
It's rare to affect the eye, but if it affects the eye, it can be severe and vision threatening.
Dr. Shantan Reddy is an ophthalmologist and retinal surgeon with Dooley. He says my early ophthalmologist appointments were crucial. A shingles rash isn't just on the surface, it's nerve-based, and when it's on your face, it attacks the trigeminal nerve. My case only went north to my scalp, forehead, and eyelid.
So the structures that we're worried about is the conjunctiva, the white part of the eye, the conjunctivitis. It can affect the cornea, which is the windshield of the eye, the front of the eye, and then that's when it becomes painful. And then if it affects that structures, then it can start to, you can have complications of blindness.
Dr. Reddy says he's seeing more and more shingles in younger patients, and no one really knows why. Doctors do know a weakened immune system and stress are major factors.
We're all more stressed emotionally, physically, long hours. This all kind of suppresses the immune system. So very healthy patients can get this.
Okay, day 4. It's starting to hurt more. You can see it's kind of starting to blister. The ones that really hurt, of course, are on the eyelid.
For the entire month of June, I was basically stuck indoors. Every time I went outside and there was a breeze, that breeze would hit the shingles on my face and it hurt. Except obviously I had to drive myself to lots of doctor's appointments, the ophthalmologist and also my primary care. But I got to the doctor quick, noticed it early, got those antivirals, and I started the healing process. But that primary care doctor, I got to know her very well. So my symptoms started with headaches, mainly. For the first, 2 weeks. Also flu-like symptoms. You could not get me out of bed. I truly felt like I had the flu. I also had kind of a scratchy throat. So that was 2 weeks. Then the next 2 weeks, that rash really started to come up. That was super painful. And then the itching would not stop, probably 3 or 4 weeks. Even still to this day, 8 weeks, 9 weeks in, it's still itchy. Let's go check in with my doctor, Dr. Barry. Elizabeth, to see Dr. Barry, please.
Hello.
Hello.
How are you?
Me again. Dr. Abba Barry is my primary care doctor with Dooley. I rushed to her after my diagnosis at the urgent care and met with her about once a week.
Aside from the rash, so you're doing okay?
Yeah. She explains shingles and chickenpox are related.
Once you have chickenpox, it never really goes away. It just kind of goes and it hides into what we call the dorsal root ganglion. And it's basically inside your nerves. And then when you're not looking, you're stressed out, boom, it just kind of reactivates itself.
I always thought it was for older populations. I am 39. Why did I get it?
Yeah, so stress is a very subjective term, right? As a matter of fact, in my career, and we've discussed this before also, is that I've actually seen it the most in women of childbearing age. They're usually either postpartum or pregnant.
She knows shingles personally. You had shingles.
I had shingles.
Tell me about it.
I was 31 weeks pregnant.
That's rough. Shingles is an inflammation of the nerve caused by the reactivation of the varicella-zoster virus, which causes chickenpox. Dr. Barry says a patient who suspects shingles needs to be seen within the first 3 days of symptoms to get antiviral medicine, which won't cure the condition, but will help you get it out of your system faster. As for managing the pain, I tried hydrocodone, I tried naproxen, I tried Tylenol, Advil, and gabapentin.
Yeah, not very helpful, right? Yeah.
Not very helpful.
That's what I was trying to, that's nerve pain for you, and that's why it is so terrible.
And it can be contagious. The fluid in the blisters is thought to carry the virus, so you have to stay away from anyone who hasn't had or been vaccinated for chickenpox. It's just tender still.
Yeah.
We're about 8 weeks in.
Yep. It takes time.
Mm-hmm. Done with my antivirals. Done with this steroid. Now I just wait.
I wanted to know more about why I was getting shingles at the age of 39. So I called on shingles researcher and microbiologist Jennifer Moffitt with SUNY Upstate Medical University. She's been researching shingles for more than 30 years and has had shingles twice.
And it went from the tip of my nose to my chin and into my ear. So it really covered that bottom third of my face. I was in agony.
That was in her 30s. She got it again in her 50s.
This time it was from my nose to my ear, but it also affected my eye, and it caused a big a bleed inside my eye. So now I have a floater in there, and it really damaged the nerves in my ear. And I had earaches for years after that.
Moffitt says in the U.S. alone, there are more than 1 million cases every year. A third of them will end up with shingles on their face, like myself. But in her decades of research, she's seen the rate of shingles increasing for all ages, except for people under 30, after the chickenpox vaccine came out in the mid-90s.
And that seems to be protecting them. But everybody else who got chickenpox as usual is at risk now for shingles.
So why are we seeing an increase in shingles?
There's something in the environment. It may be worldwide because we see this in other countries, but we don't know what it is. So we're not sure what is happening, but it's allowing this virus to wake up. Rising temperatures could be affecting our immune system. It could be pollution. It could be, I don't know. We don't know, but it's happening everywhere.
The older you are, the worse the symptoms are, and your chances increase for lingering chronic nerve pain called postherpetic neuralgia.
And that, for me, with this on my face, feels like a really, really sharp headache. And I'm used to headaches, but a really sharp headache kind of like by my ear.
So what can you do? Get your shingles vaccine if you're 50 and older or immunocompromised.
Day 30 of shingles. Still really itchy, still burning, still there.
The deal with shingles is that it is a very slow process. I do feel better, but there still is some sensitivity. So what can you do? Get the vaccine if you're 50 or older, or if you're immunocompromised, go ahead and check out that shingles vaccine. It's 2 doses. Also, be a shingles spotter, like my buddy Strel. You know the symptoms now of shingles. If you see it on your friends, your family, your coworkers, tell them about it, and they'll get that medicine that much faster. Elizabeth Matthews, Fox 32, Chicago.